Section 7. Finances and funding.
Various decisions need to be made which will impact upon costs and whether these costs can be met. These include the range of provision on offer, the pricing structure to members, and whether to focus on one meeting centre in one place or multiple centres across a region. A meeting centre may not be able to offer the range of provision it would like due to limited funds and the desire to keep costs down. Reduced provision could help keep a centre sustainable, but it could also limit your ability to meet needs and appeal to people. A meeting centre will need to carefully balance how much it charges members and how many members it needs to be viable. If charges are too low to start with, this can be difficult to change later. Running multiple centres across a region can help keep costs low through the sharing of infrastructure and resources and help meet costs through region-wide fundraising. We have the following recommendations. We suggest meeting centres carefully consider and balance what is most important and possible to offer with the limited funding available. If you offer modest or reduced provision, consider the potential impact on recruitment. If you offer fuller provision, consider the impact on available funds going forward. When setting pricing, consult with members on what they can afford and are willing to pay. At the same time, be realistic regarding what costs membership charges must cover. If running multiple centres, consider economies of scale such as shared resources and centralised administration. Many meeting centres run on a combination of different income and funding streams. Finding available external funding is a key part of supporting a centre to keep going. It is unlikely meeting centres will be able to offer a range of high-quality provision purely on income from members' fees, unless those fees are high. Therefore, some external income is likely to be necessary in order for meeting centres to be inclusive and accessible to many. Stable, ongoing community support for dementia, such as meeting centres, requires stable, ongoing funding. This is difficult to find in a funding landscape that prioritises new projects and only offers short-term competitive grants. Accessing funding in such a landscape is difficult and time-consuming and requires expertise. Health services and local authorities may recognise the importance of tackling social isolation, but they have a primary responsibility to meet the most acute medical and social care needs. Hence, they are unlikely to have as much resource available for anything else. This means funding for a social model of support, such as meeting centres, may be difficult to get. This is also true for funding to support people who attend meeting centres, but whose needs are not yet acute. Providing hard evidence that it will directly prevent the development of acute medical and care needs can help. Finally, it is better not to have all your eggs in one basket with regard to managing a meeting centre's finances. This applies whether you are seeking funding or sourcing income or allotting it to meet the various costs of running a meeting centre. We have the following recommendations. We suggest meeting centres have an experienced person with responsibility and time for making funding applications on an ongoing basis. Seek income and funding from multiple sources and organise it into different pots for different purposes. This way, you don't have all your eggs in one basket, and how money is managed to meet costs will be clear and efficient, with core activities protected. Meeting centres should gather evidence and lobby for more formal recognition of the needs and benefits of social inclusion. Of particular importance is preventing and delaying people from reaching crisis point in their health and care needs. We suggest potential commissioners and funders of meeting centres consider longer-term funding to support third sector initiatives that can demonstrate they are filling a gap or fulfilling a need in the care pathway. This way, skilled and experienced practice is not lost. Try to ensure applications for funding are not too demanding, difficult and time-consuming. This is important for making funding more accessible to grassroots organisations with limited resources. If you go to a meeting centre, make your voice heard regarding the importance of social inclusion and continued citizenship for people living with dementia and those that support them. This will help make the case for supporting more initiatives like meeting centres in the future. You can also watch our video on external relationships and collaboration.
This independent research was funded by the National Institute for Health and Care Research, or NIHR, under its Research for Patient Benefit Research for Social Care programme. Grant reference number NIHR 201861. The views expressed are those of the authors and not necessarily those of the NIHR or the Department of Health and Social Care. We would like to acknowledge and thank all Meeting Centre attendees, personnel and partners that participated in this study, as well as our research collaborators at the Three Nations Working Group on Dementia, Nuffield Department of Primary Healthcare Sciences at the University of Oxford, London School of Economics and Political Science, and Worcestershire County Council.